There are people who work on emergency duties teams who will tell you there is often not a mental health bed in England when you've got 1 foot off the end of a bridge and are actually about to jump. And I think that is an absolute disgrace. And they've got away with this, not because it's not an accident that they've done it. I think this government never wanted the health service when it was brought in 1948. They didn't want a welfare state, they didn't want benefits, they didn't want pensions, they didn't want leisure centres, they didn't want any of the things that make our lives better. And they've used this recession to get rid of a lot of what they didn't want in the first place, and they're continuing to try to do so. And they attempt to get away with it by getting us to fight each other and divide amongst ourselves. I think the worst example of it was the attack on migrant workers and the Islamophobia that I think is rife in the world and Britain at the moment. And it's interesting in the health service. The health service was built by immigrants. My mum answered an advert in Germany in 1949 to come to this country to work to become a mental health nurse because they created the health service and didn't have enough mental health nurses and cleaners to do it. And a coachload of German workers came over, and we've seen Afro-Caribbean workers, we've seen Italian workers, we've seen Filipino workers, we've seen people from all across the world come and create our health service, keep our health service going. And actually together, if we don't fight together, we won't be able to fight to keep that health service together. And I think the idea that you remove the 40% of nurses who are migrant workers, or the 25% of doctors, or the tens of thousands of porters and domestics who are migrant workers, the health service would collapse tomorrow.